Today our topic of discussion is avian influenza. This is third lecture of our ongoing course Poultry Pathology. Let's start our topic. First off, all introduction to this disease. Infection of domestic poultry by AI viruses typically produces syndromes ranging from asymptomatic infection to respiratory disease and drops in egg production to severe systematic disease with near 100% mortality. Let's talk about its etiology. This virus belonged to Orthomyxoviridae, genus Influenzavirus AI. Morphology: spherical to pleomorphic, filamentous, dia several hundred nanometer. 80–120 nanometers dia. Surface is covered by two type of glycoprotein projections. It has rod-shaped trimers of hemagglutinin, H, A, mushroom-shaped tetramers of neuraminidase, N, A. Now if we look for its pathotypes on the basis of pathogenicity, which is its ability to produce disease, there are two pathotypes. First, high-path AI viruses. Second, low-path AI viruses. LPAI viruses change into HPAI during circulation in chicken and turkey populations. Talking about its pathogenesis, steps are followed by this virus are: Step 1. HA adsorbs to host receptors containing sialic acid bound to glycoprotein. Step 2. Proteolytic cleavage of HA to HA1 and HA2 is essential for prerequisite for fusion and infectivity. Step 3. 6 monocistronic mRNAs are produced in nucleus and transported to cytoplasm for translation into HA, N, A, N, P, PB1, PB2 and PA protein. Step 4. 8 viral genome segments along with internal viral proteins N, P, PB1, PB2, P, A, M2, assemble and migrate to areas of plasma membrane containing the integrated HA, N, A and M2 proteins. Low pathogenicity AI viruses cause abnormalities in respiratory, digestive, reproductive and urinary organs. Infection of respiratory tract includes signs: coughing, sneezing, rales, rattles and excessive lacrimation. Decreased egg production, decreased activity, decreased feed, lethargy, diarrhea. High pathogenicity AI viruses causes high morbidity and mortality. Gross pathology: catarrhal, fibrinous, serofibrinous, mucopurulent, fibropurulent, tracheal mucosa edematous with congestion, occlusion of airways, fixation, fibropurulent bronchopneumonia accompanied secondary pathogens by E. coli and Pasteurella multicida. Let's talk about some clinical signs with photos. These photos are taken from Poultry Disease Diagnosis, a color atlas by Ahmed Anjem in photo 1. You can see dull and depressed birds in photo 2, there is rhinitis and sticky nose of chicks in photo 3, cyanotic comb and acute inflammation of wattles can be seen. In photo 1 there is subcutaneous edema of intermandibular space. In photo 2 there are cutaneous hemorrhages on shanks. In photo 3 green-white mucoid diarrhea can be observed. In photo 1 hemorrhages on serosal surface of proventriculus which pathognomic sign. In ND these hemorrhages are on tips of papillae in proventriculus. In photo 2 there are hemorrhages on fat around gizzard. In photo 3 hemorrhages are observed on pericardial fat. Photo 1 shows the acute mucoid and exudative nature of trachea. Photo 2 shows cloudy air sacs. In third photo there are congested lungs. Talking about histopathology, we will see fibrinocellular to peribronchiolar lymphocytic infiltration pneumonia, capillary edema. Organs: brain, heart, lungs, pancreas, primary and secondary lymphoid organs, neuronal necrosis. LPAI or HPAI, nasal cavity is major site for replication of virus, trypsin-like. Protease enzyme in respiratory mucosa cleave HA1 and HA2, multiple replication of virus in respiratory mucosa, release of virion, entry to submucosa. And replicate endothelial cell of BV, lymphatic system and visceral organ death is due to failure of organs. Damage of tissues in AI is due to replication cytokines, inflammatory mediator, ischemia, cardiac vascular collapse.